We're joined now by Admiral Brett Giroir, the Assistant Secretary of Health. Admiral, good morning to you, sir.
Good morning.
Well, we've seen the map. We know cases are on the rise. Unfortunately, hospitalizations also on the rise. And in many hotspots, the fatality rate is going in the wrong direction. You said the other day this is an all-hands-on-deck situation. How worrisome is this outbreak right now?
Well, thank you so much for getting to the heart of the matter. We are all very concerned about the outbreak, and as I think you and your viewers know, about half the cases are in 4 states, Texas, California, Florida, and Arizona. But we are in a much different place now than we were several months ago, a much better place. We're very concerned. We are sending teams out to 19 different jurisdictions. We have CDC teams in every single state. In terms of our hospitalizations, we're at about 63,000 people now. That's much different from the 85,000 people. Only about 10% of people with COVID are on ventilators. That's down from about 25%. We have lots of ventilators, lots of ICU beds. The mortality rate for any given age is way lower, but we're still very concerned because as hospitalizations go up, we would expect deaths to also go up. Even though we're turning the corner on the current outbreak, and it looks, all indications are that we have that, we won't see the benefit in hospitalizations and deaths for at least another couple weeks.
That's interesting. You say we've turned the corner. In your mind, is this virus getting under control? Because the situation on the ground seems to tell such a different story.
So, again, we look at all the data that we have, and none of us feel comfortable. Nobody's doing a victory lap. We are all very concerned, all hands on deck in the field. But the early indicators we see, for example, the percent of tests that are positive have leveled off or are going down in most of the jurisdictions that we have a problem with, and we're seeing ER visits go down in most of those jurisdictions. These are the early indicators that we're turning the corner. This doesn't mean we've turned the corner, and I want everybody to really understand you've got to physically distance, wear your mask, avoid bars, close bars in those hot areas, reduce restaurant capacity. If we keep doing those things, these early indicators will turn into successes for us. We are not there yet, but we are seeing some early light at the end of this tunnel.
You are the testing coordinator. The good news on testing is we're doing much more of it, 640,000 tests daily on average. I know you've mentioned one day had as many as 800,000. On the other hand, the bad news, labs still reporting shortages of materials. The lag time before people are getting results can be 4 to 6 days, even longer in hot spots. At this point, why is testing still such an issue?
So let me break that down for you a little bit. About half the tests done in this country, which are not reflected in those numbers, are done as a point of care or done in a hospital. The point of care, that's about a quarter of the testing, is a result within 15 minutes. Hospitals are usually within 8 hours to 24 hours. There is a lag time in some of the big commercial laboratories because the demand is so very high. So let me tell you what we're doing about that. Number one, on the big commercial labs, we're working with them and they're actively starting to pool samples, meaning putting many samples into one sample. Secondly, we are really leaning into a lot of the areas where they need a lot of testing. For example, nursing homes. We are going to be working with nursing homes to do much more point of care testing. That will alleviate millions of tests from those commercial labs. And yeah, go ahead. And still, the average in the country is about 3 to 5 days. Yep.
I just wanted to ask, because it's great that the hospital testing is faster and the point of care, meaning the doctor's office, is faster. But when the lag time is people who wonder if they have it, and then they're going out and about their business, doesn't that exacerbate community spread? I mean, that's a big problem if you're talking about those kinds of lag times.
So for those commercial labs, we absolutely want to reduce those times. We would like to get that to within 48 hours, and we are really exerting a lot of effort to do that, as I suggested. First of all, take the demand off of those labs by doing more point of care, doing more counseling to some of the areas that have some of the long lines. For example, in places like Arizona and Texas, if you wake up in the morning and just feel like you want to test, you might not need to do that, right? We need to think about those who are at high risk or in high risk situations, because there is an infinite demand, right, in those areas. So we are doing almost 700,000 tests a day on average, over 800,000 on certain days, but we still have to be careful in some of those areas to make sure that the people who need a test or those who are vulnerable can get it within a short turnaround period.
Let me ask you about schools at the forefront of the minds of a lot of parents. You're a pediatrician. The president has encouraged schools to reopen. The education secretary has said that there is no evidence of danger to kids. She's saying that there's nothing in the data that suggests kids being in school is in any way dangerous. And she's threatening federal funding for schools that don't reopen in person. Do you agree with the education secretary? Is there no danger?
So look, as you said, I'm a pediatrician. I ran a children's health system, but more importantly, I'm a twice-over grandfather, and I'm really concerned about these issues. We all know that kids need to be back in school physically for all the reasons we talk about: social and emotional health, nutrition, eye screening, discovery of child abuse, all those things that are very important. You know, we have a year now that underserved children are 1 year behind those who are more fortunate because they didn't have the benefits of a lot of the homeschooling or teleschooling. But we have to get the virus under control. And if we get the virus under better control, clearly kids can get back into school safely. There's no such thing as no danger. There's no such thing as a free lunch. But the risks to children are very, very small. We know that from the data we have here and the data we have in other countries. Also, the data are pretty suggestive now, not definitive, that at least small children have very little chance to spread it among themselves or to other people. The CDC guidelines are really on target. They kind of outline the things that schools need to consider. We're working with every school district. There is a way to get children back to school safely, and we all need to be on board to try to do that. But again, as you said, Savannah, we've got to get the virus under control more in the community. That makes everything much more easy as we approach the school year.
I want to ask you about something in the news. The White House staff have gone negative on Dr. Fauci, who is a colleague of yours on the White House coronavirus task force, even circulating to reporters a list of instances in which Dr. Fauci has been wrong in the past. He's your colleague. Does that tactic bother you?
So look, Dr. Fauci, Dr. Birx, Dr. Redfield, Dr. Hahn, we are colleagues. We work together every single day. None of us are 100% right. That's why we have multiple diverse views there. I have a more general public health perspective in my job. Dr. Fauci works on infectious diseases. Dr. Birx has the whole area. So look, none of us are always right, and we admit that. I think we have a good relationship. The Vice President listens to us all. We meet regularly during the task force. So, you know, we're just going to keep our heads down and working together. We all need to be working together to solve this problem, and we have a great collegial relationship. Tony and I talk all the time. Dr. Birx and I, you know, it is a good group, and none of us are always right. That's just the way things are. That's why we all work together, and we'll continue to do so.
Well, speaking of good information, the president retweeted to his tens of millions of followers yesterday a message actually from a game show host that said, quote, "Everyone is lying about the virus, including the CDC and our doctors," and went on to say it's really about the election. When you are in the midst of trying to combat a public health crisis like we have on our hands, are messages like that from the president problematic?
So look, I'm a physician, I'm a scientist, I'm not a Twitter analyst, and to be quite honest, I don't spend time looking at any of that on Twitter because who knows what it means and how it's interpreted. I'm just going to tell you, Savannah, we are trying to be very clear about our message, particularly in the hot zones where we have a lot of community spread. You've got to close the bars. Bars are great, but not during coronavirus because they're a place that's spread. Indoor seating capacity at restaurants, 25%. Wear the mask. Okay, these are the things that we can do to control the virus. We're trying to be very clear. I think there's unanimity of opinion on that, of assessment among the docs, among the task force. We'll continue to promote that. It's what the American people need to do, and we can stop the virus.
And in the interest of good information, the CDC and our doctors aren't lying. You're not lying.
Look, we may occasionally make mistakes based on the information we have, but none of us lie. We are completely transparent with the American people. And my experience on the task force is the vice president and everyone there has been completely transparent. We let the American people know what we know. Again, as new information comes, that may need to be changed because we're learning every day. But nobody lies to the American people. We're completely transparent and honest. That's my job. That's my job as a public servant. We take that as really a sacred oath, is to be honest and let the American people know what's going on.
And final thing to that end, the president said last week in an interview that he thinks the coronavirus will just disappear. Is that likely to happen?
Well, we are very confident that we're going to beat this virus. It's not just going to disappear. It's going to disappear because we take active steps to make it disappear. Right now, our steps are, as I outlined to you before, about the physical distancing, the masks, those kinds of mitigations. We are very bullish on our opportunity for vaccines, and you've heard all about that. The vaccine development program is going extraordinarily well. We are likely to have a safe and effective vaccine at the end of the year or at the beginning of the next. And our new treatments are coming along. We have several treatments that are highly effective and more down the pike. So, yes, I am here to work with all my colleagues to make this virus disappear, but it's only going to disappear if we work together. If the American people listen to the mitigation strategies, again, can't emphasize enough, wear the mask, physically distance, avoid crowds, combined with all the science, we will beat this virus. I'm very confident of it. Let's all stay safe. Let's all make COVID disappear, but it starts with you and your personal activities. You can really save a life. Everybody wants to save a life. Do those simple things. Save lives today, and we will defeat the virus.
Admiral Brett Giroir, thank you for your work. We really appreciate it.
It's great to be here. Thanks for having me.